Chapter 15, Problems of Adulthood. The period of life that is defined as adulthood includes individuals that are aged 18 to 65 years old. The definition of maturity is one's ability to accept responsibility for their actions, they're able to delay gratification, and they're able to make priorities. For an adult, physical growth is complete, but adults do continue to develop emotionally, intellectually, socioculturally, and spiritually throughout their life. There are various social tasks of adults. One is commitment, to be able to be important to someone and committed to a career or their work. Another is communication with another individual, with children, with their coworkers. Compromise is being able to give and take with other individuals. Parenting can be a major challenge for many adults. Parenthood is considered a 24-hour-a-day job, and the demands can create anxiety. Parents may feel inadequate, and they may have a sense of isolation or hopelessness. Individuals that manage both parenting and working outside of the home are especially vulnerable. Adults that have good mental health are able to adapt to changes in their lives. Once a personal identity has been established, the adult is capable of using their life experiences as lessons for them. They develop abilities to solve problems, set priorities, and identify reasonable expectations. Adults form bonds with each other, and they become devoted to energies in their life that guide the next generation or will help make the world a better place. Adults are able to give of themselves, both intimately and in social situations, and their confidence remains unaffected by others' opinions. In adulthood, there is always a balance between give and take. Characteristics of successful adulthood: being able to accept oneself, being able to change, being able to prioritize, have realistic goals for themselves, being able to learn from experiences in one's past, being able to use stress to one's benefit and be able to function in certain situations. An adult will also find meaning in their life. As a child, developmental problems are clear. As an adolescent, sometimes they discover that they're unique individuals that have an ever-changing system and a body. An adult must cope with decisions about themselves, relationships, their education, their job, their marriage, and family. Through learning coping techniques, individuals are able to live effectively. There are various therapeutic interventions to have a positive personal identity. As a nurse, we help the individual define their dream for their life, develop occupational choices and goals, to be able to differentiate themselves from the nuclear family by sorting through the beliefs and values that they gained in childhood, so they have their own belief system. We also help them decide about relationship choices, the level of commitment that they may make, and we help them assess how their emotions will influence their ability to achieve professional goals, personal goals, and develop healthy interpersonal relationships. Everyone has a need for intimacy and belonging, and it affects them throughout their life. Adults will usually form multiple relationships. Young adults sometimes seek relationships to fill a personal void or escape some unhappy situation. A lot of adults, especially women, are caught up in a cycle of violence that comes when they're in an abusive relationship. Even though they have frequent health care visits, many women are still not screened for intimate partner violence. Providing care for one's aging parents is also becoming a problem for many adults. Today, there are members of what's called the sandwich generation. They have the dual responsibility of providing care for their children and their aging parents at the same time. Adults may have problems with interpersonal relationships that can be social or work. These individuals will have little or no ability to see how their attitude or their behavior will affect other individuals, and they will often have difficulty forming a long-term relationship. If they have problems with interpersonal relationships, they may become unwilling to consider others' feelings. In the world as an adult, everything costs money. And many young adults don't understand this until they actually leave their family and their sense of security. If there's an absence of a regular income, it can cause associated stresses that will take the young adult on a downward spiral, and it may include poverty, physical illness, psychosocial disorders. We know that a stressful family environment with someone being unemployed may be associated with child neglect, mistreatment, and abuse. Education or training for employment is also associated with someone's economic status. People that are not educated tend to be poor, with having few financial means or savings accounts. Multiple families will live from paycheck to paycheck in today's society, where one small necessity of finances can throw the family environment into financial turmoil. Adults that are trained or educated, they have more financial stability and health care resources, and they're also more fit to handle everyday problems. Homelessness is a diverse group of individuals. Many homeless people are single men, but at the same time, more than 1/3 are women and children. Many chronically ill individuals inhabit streets because they're unable to use their resources wisely. These individuals are discouraged by prospects, and they have a greater risk for depression, drug abuse, and mental health disorders. When looking at environmental problems, before cars, everyone had a car and rapid transportation, families remained in one local area for generations upon generations. Many communities were often composed of relatives, extended family members, and these individuals were able to provide emotional and social support during difficulties. People shared their anxieties, hopes, and difficulties with each other, and they had the emotional support and energy to cope with the problems that they were encountering. Acquired immunodeficiency syndrome, or AIDS, was first recognized in the United States in 1981. Since that time, millions of individuals, especially adolescents and young adults, have been exposed to AIDS. It is spread through sexual activity, sharing of needles, or the exposure to bodily fluids and blood. AIDS prevents the body from fighting off infectious diseases, and it can cause signs and symptoms that may not show for many years. AIDS has an impact on all society members, but especially it is felt among sexually young adults. People in this age group, they're more vulnerable to contracting disease because they don't have emotional maturity and judgment to make sound decisions, and they feel that they are invulnerable because they believe that nothing will ever happen to them. The fear of AIDS has spread to individuals whose lifestyle presents them no likelihood of contracting AIDS. There's an acronym of AFRAIDS, which is acute fear regarding AIDS. This has been used to describe an anxiety-related condition caused by fear. Individuals that have poor coping skills often find it difficult to deal with the emotional aspects of the AIDS epidemic. There are many adult mental health disorders that are common. There's adjustment disorder, anxiety disorder, cognitive disorders, dissociative disorders, eating disorders, fictitious disorders, impulse control, mental disorders, mood disorders, schizophrenia, sexual and gender identity disorders, sleep, somatoform disorders, substance abuse disorders. For us as nurses, we provide therapeutic interventions as a primary way to help prevent or minimize health issues in our adult clients. Nurses use assessment skills to understand the client's description of their own problems. We make sure that our patients have a way to define their problem, and we can assist with them defining it. We help the individual understand reality and learn to cope with reality. And we will provide our patients and our clients with written educational material to help them gain greater success in their lifetime. As a nurse, we need to make sure that we are aware of various programs throughout our communities.